name is Garrett Claybaugh, and I'm Director of the Iowa Department of Public Health. Congratulations, and thank you for your investment of time and effort to be a part of the health of your community by serving on your local Board of Health. Public health is a fundamental function of government, assuring the conditions exist within your community that will allow your residents to be healthy. Your locally appointed board, along with the staff in your local public health agency, will play a central role in coordinating and collaborating with the Iowa Department of Public Health. Topics for our work together include identifying the critical health needs in your area, eliminating infectious disease and foodborne illness from your community, ensuring your residents have access to vaccine and preventive health services, working with community and health system leaders to assure everyone in your community has access to important healthcare services, and implementing public health standards, and in some cases applying for public health accreditation. I also want you to consider taking full advantage of those around you with experience and expertise to make your work better and more impactful. For example, your local public health administrator will play a key role in overseeing the work of the local agency. Be sure to challenge your administrator to share with you the important impact their work is having in your community every day. Second, cities and counties around you, while separate and distinct, are often responding to the same challenges you will be facing. Be sure to network with those nearby board members. Understand their challenges, and also be willing to share your own experiences. And third, the Iowa Department of Public Health has numerous experts in areas like governance, regulatory compliance, public health standards, strategic planning, and program expertise that ranges from child health to environmental health. Take full advantage of the resources that IDPH provides to make your work more effective. In the end, our work together is measured by our ability to improve the health of Iowans. And while this is a challenging task, each of us who work in public health know that we make a difference in the lives of Iowans every day.
Hi, I'm Bonnie Rubin, and I'm a member of the Johnson County Board of Health. I'm completing my second year on the board and have agreed to be reappointed for another term. I think I'm a bit of a novel board member since I work at the State Hygienic Laboratory, Iowa State Public and Environmental Laboratory, and have several years' experience in laboratory medicine. So my professional background has always been focused in health-related matters. I applied to be a board member when I learned of a vacancy at the Iowa Public Health Association's annual advocacy meeting in Ankeny. The current board president, Dr. Peter Wallace, made a comment that they had a vacancy. I had been contemplating how I could be more involved in my community and county. I have also been very interested and active in learning more how the Patient Protection and Affordable Care Act, the PPACA, will be impacting public health services and organizations. I asked the Deputy Director of Johnson County Public Health and Dr. Wallace if I should consider applying to be on the board. Both were very supportive, and with their encouragement and my interest, I applied and was approved. Not only have I gotten to learn more about the organization and services of our county health department, I continue to be always impressed by the numerous partnerships, both formal and informal, our department has in order to meet the needs of our county. As with Story, Polk, and Blackhawk counties, we have the added challenge of meeting the public health needs related to a large multinational university population. One of the really positive steps we have taken as a board is to share our position statements, not only with the Board of Supervisors, but with all the other county health directors and board chairs. Since I've been on the board, we have created and approved a statement on electronic cigarettes that has been used by the city, the county, the university, and other counties to establish their rules. We are hoping a more formal information sharing mechanism can be established throughout the state in the future so that all the boards can share easily their work and their efforts. Right now, we are in the phase of completing our community health needs assessment. It has been interesting to learn and watch the process, especially the steps in defining the population segments used as focus groups, and now in getting public input and review. Staff have designed a process that is a bit different in the way the assessment has been done in the past, and I anticipate the end result will be a very useful and constructive tool to move public health strategies forward for our county and throughout the state for the next few years. My truly biggest challenge and learning curve has been learning about the boundaries of an open public agenda and meeting. The agenda needs to be set and available to the public at least 24 hours before the meeting. As a board member, I need to be aware that my questions and my comments are directly related to the agenda topic and don't deviate too far from the discussion point. During meetings, I have had to learn how to pre-examine my questions and comments before I speak to ensure I have not strayed too far from the topic and ensure that my comments, which are part of the public record, are relevant and coherent and related to the topic we're talking about. Needless to say, I have learned to watch the facial and body language of our county attorney during the meetings, which is often a sign that I might be straying too far from the topic. Related to this area is the fact that as a board member, we need to be aware that when we are at social or professional meetings, when there are 3 or more of us gathered, we need to be coherent and think about what our conversation is about, remembering that our topics are part of the public record and part of the public meetings. All in all, I have really enjoyed not only learning more about our county public health department, how it works, the challenges and the successes, but I appreciate the opportunity of getting to know my fellow board members and knowing that I'm helping to make a positive difference in my community, my county, and my state. If you are a current or new board member, my best advice is to be respectful of this responsibility by not only being prepared for your meetings, but be willing to ask questions, stay current on local, state, and national public health issues, and be willing to reach out to your director and your board chair with concerns, discussion topics, and recommendations. If you are considering to be a board member, this is a very good way to be involved in your community and have a positive impact on the health of the citizens of your county and ultimately throughout Iowa.
Hi, I'm Caitlin Emmerich, a member of the Benton County Board of Health. During my 4 years of serving on the Board of Health, I have seen how we as a board are involved with the public health core functions of assessment, policy development, and assurance. The Board of Health provides guidance and feedback to local public health staff during the process of conducting the Community Health Needs Assessment and Health Improvement Planning process. Additionally, the board receives information from local public health staff regarding diseases or conditions that have been identified as a concern within the community. Policy development is a core function of the Board of Health. 2 pieces of assurance the Benton County Board of Health is responsible for are that laws are enforced and the workforce is competent. Benton County environmental health and public health staff carry out the day-to-day enforcement of laws and report back to the board on any issues that arise. Additionally, public health and environmental health workforce is discussed regularly, and the board periodically discusses workforce needs and implements measures to address unmet needs. The benefits of being a board member are numerous. First of all, being able to work with the environmental health and public health staff is a benefit in itself. These professionals are committed to improving the health of Benton County residents and are passionate and knowledgeable about the work they do every day. Second, being able to address identified needs in the community and having the opportunity to work with community members is a great benefit. In Benton County, we have many health issues that need attention and require more resources than what are available. Unfortunately, resources are limited, both in staff and available funds. It can be challenging at times to prioritize needs with limited resources. This is a challenge many decision makers in public health currently face.
Congratulations, and thank you again for your investment of time and effort to be a part of the important work to make Iowa the healthiest state in the nation.